5 subtle signs that an elderly person may be approaching the end of life. Important indicators not to overlook. As we mature, one of life's greatest challenges is coping with the changes experienced by loved ones, particularly older family members. Changes in their physical and mental health aren't always obvious, but sometimes subtle signs emerge that we can't ignore. This video will share 5 gentle yet significant warning signs that can help you recognize when a family member may be facing life's final challenges. Paying attention to these signs is crucial, as early intervention allows us to provide the best possible care and support. Number 1. Unexplained weight loss, a friendly guide. Unexplained weight loss in the elderly. When older adults experience weight loss without changes in diet, exercise, or apparent health conditions, it may indicate that their bodies are not functioning as efficiently as before. Several common causes include decreased digestive function. Older adults may struggle to digest and absorb nutrients, particularly if they have stomach, intestinal, or liver problems. Inadequate nutrient absorption leads to weight loss. Decreased metabolic function. When the body cannot efficiently convert food into energy, muscle and fat loss occurs. Conditions like heart failure, kidney failure, or other chronic illnesses can impair metabolic function. Muscle loss and reduced strength. One of the most concerning signs of unexplained weight loss is muscle loss, or sarcopenia. When the body lacks sufficient energy from food, muscles begin to break down to provide energy for vital organs. Muscle loss leads to weakness, difficulty moving, and challenges with daily activities. Reduced strength and increased fall risk. Muscle loss increases the risk of falls and injuries, especially in older adults. Problems such as joint pain, weakness in limbs, and limited mobility can arise. Changes in appetite. As people age, their appetite often changes. Factors such as reduced appetite, decreased sense of smell and taste can make food less appealing, leading to reduced food intake. Decreased appetite and nutritional cravings. Older adults may not feel hungry, or their appetite may not be as strong as before. This can result from hormonal changes, diminished senses of taste and smell, or medical conditions such as depression, kidney failure, or neurological diseases. Impact of chronic illnesses. Diseases like cancer, heart failure, or kidney failure can cause decreased appetite. Patients may feel nauseous or lack desire for food, resulting in insufficient energy and nutrient intake. Weakened immune system. A factor related to weight loss in older adults is a weakened immune system. A compromised immune system makes individuals more susceptible to infections, illnesses, and other serious health problems. Chronic illnesses or prolonged infections can reduce nutrient absorption and lead to weight loss. Reduced ability to fight illness. Older adults may easily contract illnesses such as pneumonia, urinary tract infections, UTIs, and other infections, further weakening their bodies and causing weight loss. Changes in physiological processes. The bodies of older adults become less efficient at metabolizing and processing nutrients. Furthermore, the decline in bodily functions, such as digestive and circulatory systems, can prevent the body from maintaining a stable weight. Alterations in body structure. When internal organs function less efficiently, the body may not maintain the necessary energy levels, leading to the consumption of fat and muscle to provide energy for essential functions. Addressing and caring for unexplained weight loss. When noticing unusual weight loss in an older adult, family and caregivers should pay attention and investigate the underlying cause. This may require a doctor's visit and tests to determine the root cause and develop an appropriate treatment plan. Nutritional care. Providing a diet rich in protein and essential nutrients, choosing foods that are easy to eat and digest, can help improve health. However, if weight loss persists, specialized medical intervention may be necessary. Number 2. Persistent fatigue. General health decline. Persistent fatigue often signals an underlying decline in overall health. As the body's functionality diminishes, everyday activities become more strenuous, leaving older adults feeling exhausted even without significant exertion. The aging process naturally leads to a decrease in the body's restorative capabilities and stamina, making fatigue understandable. However, when this fatigue is prolonged and unexplained, it may indicate a decline in various bodily functions. Muscle loss and reduced strength contribute significantly to fatigue, as muscles are the primary energy source for daily activities. Weakened muscles leave the body more susceptible to exhaustion, even with minimal activity. Chronic medical conditions. Prolonged fatigue can be a symptom of several chronic illnesses, particularly those that may go unnoticed or undiagnosed in older adults. Some common conditions associated with persistent fatigue include cardiovascular disease. Conditions such as heart failure, coronary artery disease, or hypertension can cause fatigue because the heart struggles to efficiently pump blood, reducing oxygen supply to the body. This leads to rapid exhaustion. Diabetes. Poorly managed diabetes can result in persistent fatigue. Unstable blood sugar levels disrupt the body's energy balance, causing fatigue even without strenuous activity. Immunodeficiency. Illnesses like cancer, rheumatoid arthritis, or autoimmune diseases weaken the immune system, leading to prolonged infections and resulting fatigue. The body's constant battle against these illnesses contributes to persistent tiredness. Nutritional deficiencies. Nutritional deficiencies are a significant contributor to prolonged fatigue. When older adults don't consume sufficient nutrients or have poor nutrient absorption, the body lacks the energy to maintain basic functions effectively. Vitamin and mineral deficiencies. A lack of essential vitamins like vitamin D and B12 or minerals such as iron can cause fatigue. Vitamin D aids calcium absorption, while B12 and iron are crucial for red blood cell production. Deficiencies can lead to anemia and fatigue. Protein deficiency. Older adults require adequate protein to maintain muscle mass and provide energy. Insufficient protein intake results in muscle loss and persistent fatigue. Depression and psychological disorders. Persistent fatigue can also be a symptom of depression or other psychological issues, particularly in older adults. Depression is more than just sadness. It can manifest as fatigue, loss of energy, and decreased interest in activities. Psychological factors. Older adults often face significant life changes, such as loss of friends or loved ones, or feelings of isolation. These factors can contribute to psychological distress, increasing fatigue. Psychological trauma. Individuals experiencing psychological trauma or significant loss may experience prolonged fatigue as a response to the mental stress. Poor sleep quality. Sleep plays a vital role in restoring the body's energy. Prolonged fatigue can result from insufficient or poor quality sleep. Sleep disorders such as insomnia, sleep apnea, or other sleep disturbances are common in older adults and can cause fatigue. Sleep disturbances. Older adults often struggle with maintaining continuous, restful sleep. Frequent awakenings or a feeling of inadequate sleep leave the body depleted of energy the following day. Medications and treatments. Medications taken by older adults can have fatigue as a side effect. Some medications for chronic illnesses or psychological conditions can reduce energy levels and cause exhaustion. Medication side effects. Certain medications for hypertension, diabetes, depression, or cardiovascular disease can lead to reduced energy and persistent fatigue. Drug interactions. The simultaneous use of multiple medications can lead to drug interactions, increasing the likelihood of side effects, including fatigue. Addressing and managing fatigue. Persistent fatigue requires addressing the underlying cause. Family and caregivers should monitor symptoms and encourage medical evaluation for accurate diagnosis. A healthy diet, regular physical activity, and improved sleep quality are crucial. Lifestyle adjustments. Establishing a healthy sleep routine and engaging in gentle physical activities like walking, yoga, or swimming can alleviate fatigue and improve overall health. Medical evaluation. For persistent fatigue, a physician may order tests to check for conditions such as anemia, cardiovascular disease, diabetes, or hormonal imbalances. 3. Cognitive decline. A friendly guide. Cognitive decline is more than just occasionally forgetting things. It's a noticeable and persistent decrease in the ability to process information and perform everyday tasks. Symptoms can include forgetting important information, such as the names of loved ones or significant events, or failing to recall daily activities. Short-term memory loss is a common sign. Difficulty planning and problem solving, such as struggling to organize and complete simple tasks like preparing meals, paying bills, or scheduling appointments. And changes in behavior and personality, including irritability, anxiety, or passivity. Individuals may lose interest in activities they once enjoyed. Cognitive decline can stem from various causes, ranging from the natural changes in the brain associated with aging to more serious conditions like Alzheimer's disease or other forms of dementia. Common causes include Alzheimer's disease. Alzheimer's disease is the most prevalent cause of cognitive decline in older adults. This type of dementia is characterized by a gradual loss of cognitive function, encompassing memory, reasoning abilities, and social behavior. The progression is typically slow, beginning with mild symptoms such as forgetting recent events or experiencing difficulty finding words. As the disease advances, individuals may struggle to recognize loved ones or manage daily activities. Alzheimer's damages brain cells, particularly in areas controlling memory, thinking, and behavior, thus impairing information processing and memory retention. Cognitive decline. Related to other medical conditions, besides Alzheimer's, several other medical conditions can contribute to cognitive decline, including vascular dementia. This is linked to impaired blood circulation in the brain, potentially occurring after a stroke or due to prolonged vascular disease. Reduced oxygen and nutrient supply to brain cells results in cognitive impairment. Parkinson's disease. Parkinson's disease, often manifesting with symptoms like tremors and rigidity, can also impair cognition, especially in later stages. Other neurological disorders. Conditions such as epilepsy, traumatic brain injury, or Huntington's disease can also contribute to cognitive decline. Natural aging. Cognitive decline isn't always linked to a serious medical condition. With age, some individuals experience mild cognitive decline, such as in short-term memory or problem-solving abilities. As we age, the brain may shrink, and some neurons die. While not necessarily pathological, this can lead to subtle declines in cognitive function. Older adults may also require more time to process information or react to new situations. Risk factors. Several factors may increase the risk of cognitive decline in older adults, including genetics. A family history of Alzheimer's disease or other forms of dementia increases the risk. Chronic diseases. Conditions such as diabetes, high blood pressure, and heart disease can increase the risk of cognitive decline. These diseases may damage blood vessels in the brain or impair its blood and nutrient supply. Poor diet. Nutritional deficiencies, particularly vitamin B12 deficiency, can contribute to cognitive decline. An unbalanced diet lacking essential nutrients can affect brain function. Lack of physical activity and stress. A lack of physical activity and prolonged stress can increase the risk of cognitive decline. Studies show that maintaining physical and mental activity improves cognitive function and slows cognitive decline. Cognitive decline symptoms vary depending on the cause and severity, but common signs include short-term memory loss, forgetting recent events, misplacing items, and not remembering actions. Communication difficulties, repeating questions, forgetting words, or struggling to find the right words. Difficulty making decisions. Decision-making becomes challenging and time-consuming, even for simple choices. Loss of interest and behavioral changes. Reduced interest in or participation in social activities. Loss of interest in previous hobbies. Cognitive decline can be improved with timely detection and treatment. Interventions may include early diagnosis. Early detection of cognitive impairment symptoms is crucial to prevent disease progression. Physicians may conduct cognitive tests or order brain imaging scans like MRI or CT to determine the cause. Medical treatment. If cognitive decline stems from a specific condition like Alzheimer's or cerebrovascular disease, medications can slow progression. Alzheimer's drugs, such as cholinesterase inhibitors, help improve cognitive symptoms. Healthy lifestyle. Maintaining a healthy diet, regular exercise, and engaging in mentally stimulating activities like reading, playing games, or solving puzzles can help improve or slow cognitive decline. Psychological support. Psychological support, such as therapy or participation in senior support groups, can improve mood, reduce stress, and mitigate cognitive impairment symptoms. 4. Recurring infections. Characteristics of recurrent infections. Recurrent infections are characterized by multiple episodes within a short period. Symptoms may be similar across episodes and include upper respiratory infections. Individuals experiencing recurrent infections often suffer from repeated bouts of the common cold, influenza, or other upper respiratory tract issues. Urinary tract infections, UTIs. UTIs can also recur frequently, presenting with symptoms such as painful urination, dysuria, urinary urgency, and flank pain. Skin infections. Skin infections like boils, abscesses, or cellulitis may reappear after treatment. Lower respiratory infections. Pneumonia or other lower respiratory tract infections can become a recurring problem, particularly in individuals with weakened immune systems. Causes of recurrent infections. Repeated infections stem from various factors, both internal and external. Weakened immune system. The immune system's primary role is defending against pathogens. A compromised immune system leaves the body vulnerable to infections and hinders effective treatment. Genetic predisposition. Some individuals are born with inherently weaker immune systems due to genetic factors or inherited immunodeficiency disorders. Aging. As we age, immune function naturally declines, increasing susceptibility to infections. The elderly are particularly prone to infections like colds, influenza, and pneumonia. Autoimmune diseases. Autoimmune diseases, such as lupus or rheumatoid arthritis, weaken the immune system, leading to frequent infections. Immunosuppressive medications. Medications suppressing the immune system, used to treat autoimmune diseases or manage organ transplants, increase infection risk. Immunosuppressants. Individuals on immunosuppressants, including corticosteroids or chemotherapy drugs, face heightened infection susceptibility. Cancer treatments. Cancer therapies like chemotherapy weaken the immune system, making infections more likely. Chronic illnesses and diabetes. Individuals with chronic conditions like diabetes, cardiovascular disease, or metabolic disorders experience more frequent infections due to impaired immune function or reduced ability to fight off bacteria. Diabetes. Diabetics have less effective immune responses, leading to increased infection risk, especially skin infections, pneumonia, and UTIs. Cardiovascular and vascular diseases. These conditions can reduce blood supply to organs, increasing infection vulnerability. Nutritional deficiencies. Poor nutrition directly impacts the immune system. Deficiencies in essential vitamins and minerals, such as vitamin C, vitamin D, or zinc, weaken the body's defenses. Vitamin and mineral deficiencies. Inadequate nutrient intake prevents sufficient immune cell production, increasing infection risk. Malnutrition. Insufficient nutrition, especially protein deficiency or malnutrition, hinders recovery from infections. Chronic infections. Some individuals experience chronic infections where the body fails to eliminate the pathogen completely, leading to persistent or recurring infections. Chronic bacterial infections. Bacterial infections like tuberculosis, hepatitis B, and chronic UTIs can recur frequently. Fungal or viral infections. Fungal infections, e.g. dermatophytosis, or viral infections, e.g. herpes, can persist and recur, especially with weakened immunity. Symptoms and signs of recurrent infections. Symptoms vary widely depending on the infection type and affected body area. Common symptoms include fever and chills. Recurrent infections often cause fever, chills, and cold-like symptoms such as sore throat or influenza-like illness. Pain and inflammation. The infected area may be painful, swollen, red, and warm. These symptoms can persist and recur. Fatigue and hypotension. Prolonged fatigue may follow each infection, and blood pressure may drop due to the body's weakened state. Cough or shortness of breath. Respiratory infections may cause persistent cough, shortness of breath, or wheezing. Skin or mucosal discomfort. Sores, boils, or other signs of infection may appear on the skin, in the mouth, or on other mucous membranes. Management and intervention. Treatment for recurrent infections depends on the underlying cause and severity. Interventions include antibiotic or antiviral therapy. If the infection is bacterial or viral, a doctor may prescribe antibiotics or antivirals. Appropriate medication for the specific infection is crucial. Treatment of underlying conditions. If a chronic illness like diabetes, heart disease, or an immunodeficiency is the cause, managing these conditions reduces infection recurrence. Dietary improvement. Improving diet and supplementing essential vitamins and minerals strengthens the immune system, enhancing the body's ability to fight infections. Immune system enhancement. Maintaining a healthy lifestyle, regular exercise, stress reduction, and adequate sleep boosts immunity and reduces infection risk. Number 5. Changes in respiration and circulation. Respiratory changes. Breathing involves taking in oxygen and expelling carbon dioxide. Abnormal breathing patterns can indicate underlying health issues. Common changes include dyspnea, shortness of breath, This is the feeling of breathlessness or needing extra effort to breathe. It's a common symptom of cardiovascular and respiratory diseases. Causes may include cardiovascular diseases, e.g., heart failure, coronary artery disease, angina, lung diseases, e.g., asthma, pneumonia, COPD, lung cancer, heart failure, reduced blood pumping efficiency leading to oxygen deficiency, and metabolic disorders, e.g., anemia, severe infections. Tachypnea, rapid breathing, and bradypnea, slow breathing. These can signal health changes. Tachypnea often occurs when the body needs more oxygen or experiences oxygen deficiency, e.g., fever, pneumonia, or cardiopulmonary diseases. Bradypnea, excessively slow breathing, can occur in cases of drug overdose, respiratory failure, or neurological disorders, e.g., head trauma, neurological diseases. Wheezing. This whistling sound during inhalation or exhalation is common in lung diseases like asthma, COPD, or respiratory tract issues. Asthma causes airway constriction and blockage, leading to wheezing, especially during inhalation. COPD causes breathlessness and wheezing due to airway obstruction, particularly in long-term smokers. Circulatory changes. The circulatory system, heart and blood vessels, transports blood to nourish organs and tissues. Circulatory changes can cause noticeable signs like irregular heartbeat, unstable blood pressure, or chest pain, indicating serious health problems. Hypertension. High blood pressure higher than normal. Uncontrolled hypertension can damage the heart, blood vessels, and other organs, leading to stroke, heart attack, or kidney failure. Causes include genetics, unhealthy lifestyles, high salt intake, alcohol consumption, inactivity, and underlying conditions, e.g., diabetes, chronic kidney disease. Symptoms. Often asymptomatic, but severe cases may cause headaches, dizziness, or blurred vision. Hypotension, low blood pressure lower than normal, causing dizziness, fatigue, and fainting. Causes may include heart failure, inadequate blood pumping, blood loss, trauma, surgery or diseases, severe infections causing shock, and endocrine disorders, thyroid or adrenal gland problems. Arrhythmia, irregular heartbeat. The heart beats too fast, too slow, or irregularly. This serious symptom can cause circulatory and oxygenation problems. Tachycardia, rapid heartbeat over 100 bpm, can be caused by stress, anxiety, heart disease, or electrolyte imbalance. Bradycardia, slow heartbeat under 60 bpm, can be caused by heart failure, conduction disorders, or medication side effects. Sudden arrhythmias, e.g., heart attack or electrical heart disorders, can cause irregular heartbeats, increasing the risk of stroke or heart failure. Chest pain. Angina. Chest pain can indicate cardiovascular problems, especially coronary artery disease or heart attack. Pain occurs when the heart doesn't receive enough blood and oxygen, causing myocardial ischemia. Myocardial ischemia chest pain often occurs during exertion or stress and may subside with rest. Acute chest pain, sudden, severe, and prolonged, may indicate a heart attack or unstable angina, requiring immediate treatment. Management and intervention. Addressing breathing and circulatory problems depends on the underlying cause. Approaches include prompt diagnosis and treatment of underlying diseases, cardiovascular diseases, diabetes, asthma, lung diseases, lifestyle changes, healthy diet, regular exercise, stress reduction, no smoking to improve circulation and breathing, and medication, blood pressure medication, chest pain relievers, arrhythmia medication, or lung disease medication to control symptoms and prevent complications. If you notice these signs in your elderly loved ones, please don't ignore them. Early recognition not only allows you to prepare mentally, but also enables you to make crucial decisions for their better care in their final years. Don't overlook these indicators. They may be key to providing the care and love they deserve.